Hello family, how you all doing? Hope you guys are good. Hope you guys are fine. I have something that is disturbing me and I feel today we should talk about it or discuss it rather. Please, if you have a deep cut or a deep wound that have stayed for long, 1 month, 2 months, is not healing, rather it's even getting worse. Please, I'll advise you to go and check your sugar level. Please, if you have a wound, a deep wound, a cut that is not healing, or the healing process is very, very slow, please kindly go and check your sugar. If your sugar level is high, the healing process will be very slow. In fact, it will even be getting worse instead of healing. So please check your sugar level. Most of this wound we are seeing, we call it ochere. My dialect, we call it oture. Most of them, they are not oture. Most of them, they are not ochere. It's just because the sugar in your system is very high, thereby making the wound not to heal. And the worst thing that can happen to somebody that has diabetes or the sugar level is very high is getting a cut. If you have a wound, a small wound, as a diabetic patient, as a DM patient, you have a cut or a small wound, please kindly rush to health center or a hospital for that one to be treated. Please, and go to a nice place where your sugar level will be monitored. Don't just treat it at home, and it may get if treating it at home may get worse. So please, I'll advise you to visit hospital. For that one to heal, there should be a good medication given to you to lower the level of sugar in your system. It can come in tablets, it can come by giving you insulin, and as well a good method of dressing that wound will help you a lot, which you cannot do at home, which you cannot handle except you have been taught on how to do it in the hospital. Then when you come back home, you can now do it by yourself. I can only agree with you in that your ochure and ochure or whatever, when you have gone to hospital, um, um, when you have gone to hospital, check your sugar level. Your sugar level is normal, and a lot of treatment has gone, and the leg is not healing. I can now listen to you, but please, if you have a wound or a cut, or you know somebody that has a wound, as you are treating it, kindly check your sugar. It may be that your sugar level is high, and any amount of dressing or whatever you're doing on that leg, when your sugar level is high, it will not heal. The chances of healing is very, very low. The chances of that leg healing is very, very low. So please check your sugar level. As you are treating that wound, check your sugar level. Wherever you are, do you have a wound now? Looking at me, please kindly check. Just pause a bit and tell the person treating that wound that you want to check your sugar level. If you don't have the glucometer at home, visit hospital to check your sugar level. If you don't want to go to hospital, go to health center, go to pharmacy. A lot of pharmacy, they have, you have chemists around you, they have glucometer. Tell them that they should check your sugar. If they check your sugar and your sugar is high, believe me, that wound will not heal. The healing will be very slow. I've seen a lot of cases where the patient is DM, a diabetic patient, the wound doesn't heal. Rather, when the person will now finally come to hospital, you will be seeing maggots coming out. You will use your hand to be, bringing down maggot from someone's leg. And that is something you should have avoided for long, had it been that you visited hospital earlier. And when you see maggots, that means maggots coming out from somebody's leg or any part. That means there is no blood flow to that particular area, which may lead to amputation. So before your negligence will cause your leg or any part of your body to be amputated, I will advise you, please kindly go and check your sugar level. And if it's high, treat it. Try to reduce it, not treat it rather. Try to reduce it. Try to visit hospital. Try and reduce it. And once it's coming down, you will see that one heal. So the bottom line, if you have diabetes, if your sugar level is high and you have a wound, it will not heal. Rather, it will get worse. And you will not say it's oture and ochere. It's just that your sugar in the system, the sugar in your system is high. So please do this little thing if you have any wound or if you know somebody that has it, and let's see how that wound will go. You will see that there will be a very big difference on that wound. Thank you so much, and please don't forget to subscribe to my channel, like, and also comment. Thank you, and bye.